So continuing on, the factors that influence our health and our fitness development are various different variables that can have that potential change within us. Things like genetics, so our genetic makeup, what makes us us, and that comes from different chromosomes and how we are built. Anything that's hereditary, so we take on health and implications from medical issues from parents and the generations that have been before us, and how they lived their life and how that is now affecting us. So the way you live your life is now going to affect the kids that you have and going on moving forward in life and their kids. Body type, so when we're born, we're born with those chromosomes and the genetic makeup. We're not all going to be slim, six-pack ripped by the time we start and when we're 6 years old. Some of us are going to have different makeup where we've been fed different things at different ages. We've been born heavier than what other children are, and you develop and you grow at different rates. So our bodies can change and come from ectomorph, mesomorph and endomorph, which is somatotypes and the way we look at our body. We break those down into ectomorph, which is a tall, slender human being. So they might have low amount of muscle mass, low amount of body fat, and they're quite kind of slim and slender. If we look at mesomorph, the way to learn this and keep this in your memory is the M stands for muscle. Someone that's got large amounts of muscle mass, smaller amounts of body fat, maybe not as small as ectomorph, but they're built. They've got higher muscle development. And then the last one is endomorph, which is the opposite to an ectomorph, which is whichever height, but is holding a lot more body fat. Muscle mass is limited, but they just look a lot rounder, around the waist, around the legs, and you can see the physical difference. Now, if we take those somatotypes, we can combine them sometimes and what we call skinny fat people, and that's an ecto-endomorph, when they're quite slim in a lot of parts of their bodies, but they've got a belly and they're round in certain areas. They might have thicker thighs but a slim waist, and that comes from our genetic makeup and how we've lived our life. So as you get older in terms of what you do and how you feel and what you consume, you might, as job pressures come up, as the free time starts to dip, you might not exercise as much. You might start eating unhealthily, getting a bit more comfortable in a relationship and things like that. So within muscle memory and how our body keeps that, you're going to be able to keep and remain a certain amount of muscle, but you're going to develop fat stores in terms of hereditary where you genetically keep them. So with females, they tend to hold a lot of fat within their hips, their glutes and the lower extremities and within their arms. If we look at men, they tend to hold a lot of fat within their upper chest, their back and their stomachs. So us as human beings, as male and female, being gender, can have a massive implication and a variable between what is healthy and what is not healthy. So we have to consider what's healthy for a male and what's healthy for a female, and those variables are going to change. And the big factor within male and female is the menstrual cycle. So if we look at female clients, if you're working with females, you need to consider the menstrual cycle in terms of what's acceptable for them to do and what's healthy for them. So if you're in a calorie deficit with a female client and they're going through their menstrual cycle to a certain point, their progesterone and their estrogen levels are going to come up and come down. So we need to look at that, and we need to make sure that they enter a calorie maintenance within a certain part of it to reduce those hunger hormones and prevent them from gaining weight that is fat by overeating and getting those indulgent and feelings and cravings for food. So us as practitioners, we need to learn about the human body, whether it's male and female, and the hormones that we all have differently in levels. Another variable that we have that we need to consider in terms of what can change our health is our age. So as we get older, when we're younger, our metabolism is going to be quite high. Some people might have a low, but generally, our metabolism is going to be a lot higher when we're younger than when we're older. Not comparing to different people at different ages and stuff like that. Everyone's got their own metabolism. But the older you get, your body starts to slow its metabolism down, stops developing and progressing and growing in certain ways as it starts to calmly come to a point of its hormone levels are at a nice level. So your diet's going to change. And your physical exertion is going to change, and what you're able to do is going to change based on how you've lived your life. So when you come to the age of 60 and you've got a banged up body and you've been trying to do too much and you've not been feeding it with enough nutrients, you're going to have an implication of that, whether that comes down to arthritis and joint issues in terms of having a vitamin B, vitamin D, poor nutrition within those nutrients, or if you haven't been getting a certain amount of nutrients within other aspects like your folic acid and certain other minerals that you could use for bone health, then you're going to have a lot of fractures that you could potentially put yourself in and cause a lot more damage within your body. Other factors that we like to think about is how you live your life. I keep saying that. So how you live your life from a young age to an older age is not going to only impact you, it's going to impact the kids that you have and their kids and so on. So the lifestyle factors that we can need to consider within how we can change those variables to impact the health of our clients is their everyday activities, whether it's planned gym sessions, NEAT in terms of non-exercise activity thermogenesis, and just doing normal random things like fidgeting, moving in chairs, eating. All those different things are going to burn calories. So the aspects of burning calories is in one side, and then the aspects of consuming calories is another side. When we eat food, we need to know what type of food it is, the nutrient density of it, quantity of that food, the timings of when we eat that food, how the variety of those foods that we eat and consume. Other aspects of our lifestyle that we need to consider within health: smoking, alcohol consumption, drug abuse and use, people using not only illegal drugs in terms of category drugs, but abusing things that they get from the doctors and prescribed can change our body. If people start using paracetamol and things like that, cocodamol, then your body gradually gets used to that. And then at an older age, when you maybe don't need it as much, when you need it more because of the implications of being older, your body's grown a natural immunity for it. So then it's not going to have that same effect on you. So when we take our fitness and our health and we apply it into training, we come up to different variables, not for health, but for fitness and the way we train. So principles of training that we need to manage and implement within our client and adapt and change along the way, depending on what their needs and their goals are, come down to progressive overload in terms of progressing different exercises gradually over time, increasing either the weight, the time under tension, with how slow they're putting that muscle through that concentric and eccentric movement, the amount of reps that they do. So we talk about hypertrophy being a rep range of between 8 and 20. Now, your muscles aren't going to be able to lift the same weight at 8 reps as they're doing for 20 reps. So you need to be able to adjust that weight so that they can manage that rep range. So our body's muscles adapt and change and actually get a lot of benefit from hitting a rep range of, if you do maybe 3 sets, your first set will be a rep range of between 6 and 8 at a heavy weight. So you're submitting that muscle to that rep range and higher amount of volume in terms of the weight on the bar. And then your second set might be slightly less weight, but more reps. So you're still creating that muscular tension within the muscle to allow growth. And then if your last set is almost like a back off set where you do a little bit less weight than what you would do for your middle set, and you do a lot more reps in terms of you go to failure but you don't go past 20, and try and get that muscular tension because you're trying to pump blood and get a lot more of the fibers, because not all fibers within a muscle are going to be contracted and used within all of your reps. So you need to be able to contract those muscles, whether it's type A or type B, type 1 or type 2, depending on which ones they are, they're going to contract at different rates. So you need to be able to attack those and contract those so you can then get that benefit. Other variables within principles of training that we talk about is specificity. Now, this is probably the most important one. If you're not training for if you're training for a specific goal, and you're doing different exercises, and it's not specific to that goal, then what you're doing is pointless. So what the whole point of training is everything that you do in terms of exercise selection there's going to be a consequence to that in terms of physically, emotionally draining and stuff like that. Now, your job as a trainer is to assess your client's goal and then pick the exercises that are specific to that have the consequences that they can recover from. If they're going to go and do large sets of a back squat and then go to work, that's not appropriate. The consequences are too much for them to be able to recover for it, to have a normal day and enjoy the rest of their life, because they're going to be in agony and feel the pain and the strain. So you need to be applying those levels of specificity in what you choose for your client in terms of the exercise selection and appropriateness for them. Another principle of training concept and variable is adaptability. So if you're in a gym and if you get to the gym at maybe 5 o'clock after work, your client comes in, she's half an hour late. At that sort of time, it's busy time of the day. There's a lot of people in the gym. You've set out a program that is an amazing periodized program that's got progressions and different variables that's allowing those muscles to be hit, and she's getting loads of progress from it. But then you come into the gym at that time, she's maybe half an hour late. You need to then adapt. There's a piece of equipment that's being used. You don't want her to drop that heart rate and wait for that because she's been paying you for an hour. So you need to be able to adapt that, or adapt in a way because of an injury or a niggle that client has got. You need to be able to look at and assess that consequence. Is doing the bench press when she's got a niggle in her chest or his chest, or if they're doing a deadlift and they've got a little niggle within their calves, then do you assess that and change that out and move that around? Instead of doing a deadlift, you change that and do a rack pull. It's going to target the same muscles but slightly different movement, so less strain on certain joints. Another variable that we need to consider as trainers when we think about our clients is the recovery time. So when we play with recovery time, we think about how and what exercises need more. So the aim of it is, if you're increasing muscular strength or power, then you need to be able to lift as much weight as quick as possible to develop those two components of fitness. Now, to do that, you're not going to say you've got 30 seconds rest, because then you're not allowing the muscle to incorporate and resynthesize the amount of ATP that it needs to be able to contract the muscle to get that bench press or that movement up. Okay, so you need to apply the appropriate amount of rest for that. If you're using exercise to reduce fat loss and you're putting them through a circuit type of workout or drop sets, then you're going to apply a little bit less time in terms of recovery time. You're going to say you're going to do a set of 8 and then 30 seconds rest. You're going to do another set of 8 on a lower amount of weight, and you're then manipulating that recovery time to benefit the client for the goals that they are. So we keep referring to that goal all the time. If we're putting something into our client's plan that isn't for their goal, then you are putting in a pointless part of an act for them. So we need to apply these theories and practices that are appropriate for them. So if we move on to our next variable, we look at regressions. So regressions are quite important. And we look at regressions not as if they can't do it, then they need to do something else. Regressions are useful for when you've put your muscles through a certain amount of exercise and a muscle tension that they then can't physically put themselves through that exercise again. So if you regress that exercise, or you regress the amount of weight or the amount of reps so they can then do it again, then you're applying that regression in an appropriate way for them to be able to incorporate and contract as many muscle fibers that they can to develop and tear and create that muscle protein synthesis afterwards to grow and create hypertrophy. So when we think about specific adaptations, we think about the imposed demands of our exercise. So the adaptations to exercise we talk about in terms of physiological, we think about muscle growth, heart in terms of cardiac hypertrophy. If we're on a treadmill, to apply it to cardiovascular fitness on a treadmill, doing either HIIT training or low intensity interval training, those adaptations need to be specific for the goal of your client. So if we look at the other side of principles of training and we consider the negative aspects of if we get our client to progressively overload for so long, they're going to eventually hit a plateau. So what a plateau means is that weight that they're lifting at a certain rep range, they're not going to be able to increase. So they're just going to dip and sort of continually do the same rep range and the same weight for a continued amount of time. And we don't want to do that. We want them to see them progress healthily over a set amount of time. So to overcome that plateau, we're going to focus on different variables, not just increasing the weight on the bar or the repetitions. We're going to look at different variables such as volume and frequency. So if we include more volume, we might do an extra set or an extra 2 sets or swap out the exercise. So if we can't progress on a bench press, we can then target that same muscle with a different exercise. Apply the same principles and to a varied exercise to allow that the difference in muscle fiber contraction and recruitment for them to then progress. You can then come back to that exercise and see that progression over a different time after doing a varied amount of time on a different exercise. Now, if we look at the frequency, what we could do in terms of applying that frequency to overcome that plateau is if you're doing a push day and you're focusing on chest and shoulders, then you might add an extra push day at the end of the week, so you end up training chest twice to allow more frequency on that muscle to then increase the stimulus for muscle growth to then get that added muscle to then push that extra weight on the bar for the next rotation of exercise weeks. Now, another concept of principles of training on the negative side is reversibility. Now, if we are training our client for a period of time and then they stop, they go on holiday for 6 weeks, a long holiday, or they just stop training, things happen in life, what you're going to find is a slight muscular change and adaptation where your body changes and adapts and grows because you're applying stimulus. It's almost like a caveman. So in those sort of days, you get a rock and it falls on you. What's going to happen? The caveman's going to push that rock off of himself. What his body's then going to do is going to adapt, grow more muscle, so that if that rock falls on him again, he's going to easily be able to move it on. But if he doesn't get another rock for another couple months, then that muscle, he's not needing that muscle to use, so he's going to remove that muscle and the body's going to reverse into what it would have been if it didn't need that stimulus. So that's what happens. Now with reversibility and you start training again, we consider muscle memory. And the amount, if we grow muscle, it's a lot easier for us to then regain that muscle after a period of time if we've then lost it. So through the process of this course, you're going to hear a lot of me talking about muscle growth and hypertrophy and adaptation in terms of the stimulus for growth and hypertrophy and how our muscles get bigger and stuff like that. But what I want us to think about in terms of our clients as well is regular exercise is one of the most important things that you can do for your health. Now, the World Health Organization suggests that at least 30 minutes of exercise can reduce the implications and decrease the amount of risk of so many different health issues like coronary heart disease, risks to some cancers. It can normalise your blood pressure. So if we think about our blood pressure and how the older we get, our capillaries and our veins can actually constrict a little bit which if we do exercise, it can allow that dilation of those arteries and veins to a normal level, to allow blood pressure to normalise and become a lot healthier. It decreases high cholesterol. So when we see male clients of a certain age, what we notice is they probably consume high amount of saturated fats or a high amount of alcohol in terms of beer, and we look at the type of people that age group is and what they're consuming. What they're consuming is going to cause some high cholesterol. So exercising for 30 minutes a day can reduce that high cholesterol by up to half. What exercise does as well is it promotes bone density, so it protects you from anything like osteoporosis, bone mineral diseases, and it can allow you to get to an older age where you aren't as frail and as beaten up as some people see if they're living a sedentary life. As well as our osteoporosis that we're reducing the risk of, we reduce the risk of type 2 diabetes. Now, diabetes is one of the most known killers for men over the age of 40. So we look at diabetes, and we've got type 1 and type 2. So type 1 is hereditary. This can happen to any of us. It can be something that happens to you when you're 12, something that happens to you when you're 35. But type 2 diabetes is an implication of poor health. If you put bad foods into your body and you increase those stress hormones and you increase the amount of weight on you, your body's going to then have to move the blood and transport that around you. It's going to have to, your heart is going to have to do so much more to regulate those hormones and move the blood around, that your insulin levels then start to get impacted, which can then cause type 2 diabetes, where your pancreas actually stops working as well. So as we continue talking about training and the health implications, what I want to talk to you about is the effects, the short-term effects of what training does to us as people. So over a long period of time, we talk about how exercise and physical activity helps our health, but then short-term, what happens immediately. So if we look at what we do on a treadmill or in the gym or playing football or any type of sport, the immediate response that we can physically see is someone's going to start sweating. They're going to have red blemishes, they're going to start coming out, and their skin's going to start getting hotter. So what your body does, it sweats to reduce that temperature, release that water, it increases the blood flow to allow more oxygen uptake in the breathing to get oxygenated blood round to the body. Cardiac output and stroke volume increase to allow that to happen. Our blood vessels dilate to allow the blood that our heart is trying to pump round to get round quicker. So all of these things are going to help our body respond to that form of exercise, whether it's training in the gym, training on a football field, going out for a walk or a run. That's what we're going to see depending on your level of fitness. So other aspects of short-term effects of training that we'll not see, that we know will happen, is the concentration of CO2 rises and the blood leading to increased breathing. So we'll be able to see that by instead of just normally breathing through the nose, your client will be responding to maybe breathing through the mouth, taking larger gulps of air, controlling that breathing so the oxygen flow goes in, but then the CO2 comes out as a response and a byproduct. As well as that, we'll find levels of lactic acid will rise within our muscles. So when we talk about ATP being produced and used in our muscles, the byproduct of the molecular breakdown of ATP, you lose a triphosphate molecule and you then gain a lactate molecule. So lactate is then the byproduct of that use of ATP, causing lactic acid, which can then be stored, and over a certain amount of time that lactic acid system is then used to then reform and resynthesize that level of ATP in a different energy source. Another aspect of short-term effects of training would be your blood pressure increases. So your blood pressure is how quick the blood goes around your body. So if your muscles need that oxygen, then blood pressure is generally going to increase to allow that to happen. And then another form is with movement and contraction. To allow that movement, we talked earlier about the flexibility in our joints. So our joints become more movable and mobile, which is the response of increased synovial fluid, which is the hydraulic, almost hydraulic fluid within our joints that allow freedom of movement. And not, if we didn't have that synovial fluid, then it would be a lot more stiffer and a bit more rickety. When we stop training, all of those effects are then going to gradually slow down and stop, because then we're not exercising as much, so our body then comes back to its normal resting homeostatic place. Also, to include, the fitter you are, the less response to these you're going to have. So if your fitness levels are quite high and you're going out for a run, you're probably not going to, and your body is efficient at using oxygen as you've trained it to be. Your body's efficient at resynthesizing and using ATP in those lactic acid stores. You're going to see those short-term effects of exercise decreasing as you get fitter along the way. So if we consider we've considered ourselves what happens after exercise and during exercise in terms of the short-term response. If we completely stop exercise, so if I give you an example, we're on a treadmill, we're running for 25 minutes at a nice controlled pace, we see the short-term effects of our body's response to exercise, and then what you're going to do if you get your client to then just stop, what you'll see is a red face. They probably get a lot of headaches, probably feel a lot flatter, and just feel a bit dizzy. So that's what we call blood pooling. So if you stop suddenly, blood and the waste products that stay within your muscles are going to stay there. So that flow of blood that goes around your body isn't going to be used, so that the lactic acid buildup is just going to stay there, and you're going to get DOMS, which is delayed onset of muscle soreness. If your body can't remove that waste product in terms of lactic acid, then you're going to have that response in delayed onset of muscle soreness. To reduce blood pooling and DOMS, what we would do is we would slow down our exercise to a gradual rate, which would come down to a cool down. If you're running at 25 minutes on a treadmill, instead of just stopping, run for 20 minutes and then you use that 5 minutes to slow the pace down, so they'll come to a gradual stop, and do it in that way. So your body then is responding, and visually, and it will respond in a way that it knows it's reducing the expenditure, it's reducing the output, so then all the physiological effects will then gradually stop and come back to its normal homeostasis. So as we continue to look at the responses our body has to exercise, we need to look at the variables that we use as trainers to gain more change from our body in terms of the client's goals. So earlier I discussed variables as frequency and volume. Being frequency, the number of sessions that you do on a certain body part a week. Volume being the amount of sets on a body part that you do. There is an optimal amount of sets that you can do per body part as a response to it. So if we look at the pectoral muscles, the optimal response will be dependent on the person themselves, but through theories and research that has been taken out, the optimal amount of volume in terms of sets per week done for that muscle to gain the amount of stimulus to grow would be between 12 and 14 sets. And each muscle is going to have that set volume optimality depending on the individual, and a variable that's going to have a difference in terms of changing that is training time. And how long they've been training. So their experience in the gym, the experience of doing exercise, how many reps has that muscle been through that stimulus before applying that optimal amount of volume on it. We don't want to see a beginner coming into the gym and doing 4 sets on an exercise, as they don't need that amount of stimulus to grow. Why push them through that amount of stress to get to that goal when they can apply 2 sets on that particular muscle and get the same benefit as what four sets would do, just without as many consequences as doing 4 sets. As the more stress that you put on a muscle in terms of contracting, the more joints are going to be used to do that movement. So the more we move, the more sets that we do, we put our body through those consequences in terms of joint pain and adaptation in terms of what our body would do and physically change to benefit that. Another principle about variations and variety that we do and variables that we use is the principles of FIT, which stands for frequency, intensity, time and type. So we've talked about frequency. We've touched base on type, but we'll go through it a little bit more. So the type and choice of activity. So this is your exercise selection. So if we've got an individual that is a mesomorph, somatotype, and they've got some physical training experience, what their goal would be, they want to gain muscle mass. They want to get bigger because then in the summer they can feel better when they go on holiday. Now, variables that you want to apply for that is other than the nutritional calorie surplus to gain muscle and grow would be the variables of exercise selection. Why you would choose to do an exercise, say if you're picking a leg day, you have the choices of exercises that you do. You either put them through the compound lifts first because they've got more bang for the buck in terms of applying stimulus to the muscle, which would leave them more fatigued, those hamstrings and quadriceps more fatigued when you go into isolation movements. Now, if you flip that back over in a different variable way, if you do your isolation movements in terms of maybe a leg curl or a leg extension, applying as much stimulus and weight to that, then go in, because then you've isolated them initially, torn those muscle fibers from a lengthened position. So if you sit down in a leg extension, your cushion is extending that quadricep, so it's actually then contracting from a lengthened position to a shortened position, which is at its weakest. And then if you do a squat after, or a leg press after that, it's going from a shortened position to a lengthened position. So there's different variables of what our muscles are lengthened and shortened when they start the exercise, the amount of recruitment of muscle fibers that you need to apply to move and shift that weight, can all be different reasons for exercise selection. Another maybe case study or a thing to think about if you've got a client that is trying to lose fat is what type of cardio are you going to apply? So the best form of reasons and ways to lose fat is by adding muscle mass. The more muscle you have, generally, the higher your metabolic rate. The higher your metabolic rate, the more calories you need to actually create a homeostatic place for your body to feel comfortable within. Now, if you're able to eat more, you're then able to be in a deficit to lose that body fat. So eventually over time, because time is the biggest variable, over time you'll end up increasing muscle mass and losing body fat as a result. But to apply an even better way to do that is, and maybe fast track that fat loss, is building that muscle but then using cardio tools as a tool in our toolbox to then burn that fat in the fat burning zones. So we could use LISS, which is low intensity steady state cardio. So if we think about our heart rate monitors and our zones, where we would put our clients through certain zones of their heart rate, we want to be looking at 120 to 140 beats per minute to optimize the lipolysis and fat use as an energy source to burn that fat. Now, in terms of timings, we might use a different cardio method called HIIT, high intensity interval training, as your client might not have 45 minutes or 30 minutes that they can spend on a bike or a treadmill. They might want to do 15 minutes, high intensity, 30 seconds rest. 1 minute, high intensity, 30 seconds rest. Do that for the same. They might end up burning the same amount of calories, so they're in that calorie deficit as they would do for the steady state, low intensity exercise. but there's going to be some consequences to that there's going to be more joint activation in terms of impact on those joints, sprinting, impact on those. So if you're thinking about the time and the type of exercise that you select, cardio base, you want to think about the impact on those joints over a period of time. Now for me, I want the least amount of impact on my joints or my clients' joints. So I might suggest and put an intervention in for them to use the bike or swimming and things like that. There's less impact. If you get them running, there's a neurological response which can be quite impactful. And if you think about the difference between the neurological response of cardio being running and the neurological response of weight training, lifting heavy weights, they're quite similar if we look at some studies about what they are. So another variable of fit in terms of intensity is the level of work performed during an active session. So, and that can apply to weight training or cardio or any form of exercise, and we can rate that and score that with different scales. So we've got a Borg scale that we can use, and we can ask our clients when they're doing exercise, and specifically cardio as a good example, if they're on a treadmill and they're going through the motions of it, their Borg scale between 8 and 20, 20 being the hardest, 8 being the lowest, and they say an 8, then they're not being pushed enough to create enough stimulus for their body to adapt, because that's what you want to do as a client, as a trainer. You want to be able to force your client's body to adapt to the stimulus.